The country has made some important gains in reproductive, maternal, newborn, child and adolescent health over the years, but still faces considerable challenges in advancing transformative gains. It is against this backdrop that the World Bank School of Public Health, the Sweden government and the Ministry of Health are convening a 2-day dissemination meeting to identify entry points in improving reproductive health outcomes. The Direct Clinical Services at the Ministry of Health, Dr. Charles Olaro, says the ministry will look into the research findings to translate them into policy and guidelines.
In terms of numbers, as a ministry currently we are reviewing the structures of all our facilities from health center free up to the national hospitals. So we are looking at populations have grown, we have looked at workload, and then also we are looking at skill mix, because if you deploy a surgeon and you have not deployed an anesthetist, then you won't be able to achieve. So some of them already, the recommendations have been addressed. Issues of few staffings, we are looking at that. We are also cognizant, definitely in tandem with some of the recommendations from WHO. For every midwife can only deliver 175 mothers. So
some of the researchers noted that the high burden of reproductive, maternal, newborn, child and adolescent health conditions can be attributed to poor quality care, which in turn is as a result of inadequate financial governance arrangements and weak multi-sectoral coordination.
The other key issue that we found out was that the heavy involvement of political interference in the appointment of these governance bodies. One is given a responsibility on the basis of supporting a given candidate rather than on one's competencies. And the guidelines do not actually put a threshold in terms of competencies that one must own for him or her to be on the governance committees.
So a health center for delivering or doing antenatals, giving a service, a workload of more than the regional referral hospitals, and we keep a blind eye to that.
The most recent data from Uganda Demographic and Health Survey 2016 indicates that between 2001 and 2016, the maternal mortality ratio declined by a third, from 524 to 336 per 1,000 live births, and the infant mortality ratio declined by a half, from 88 to 43 per 1,000 live births. Zahara Abigaba, UBC News.